country's human resources is considered a major capital and a factor of development. Across different sectors, nations groom their manpower, hoping to leverage this skilled labor to advance themselves in science, technology, art, and other fields where they desire advantage. For a while now, Nigeria has witnessed a mass exodus of its young but skilled population to other countries in search of greener pastures. Recent pictures and stories from the health sector in particular reflect how acute and bothersome this trend is. The silent question in the minds of many Nigerians is, for how long will this poaching and headhunting of our best continue? On the panel this afternoon, we ask the same question and more. While our panelists provide answers, the conversation is set to begin, and we will address this issue today. I am Jennifer Igwe. Stay tuned. Now, to discuss this issue today, I have with me in the studio Toye Sobande. He is a strategic leadership expert, fellow of the Institute of Management Consultant, and member of the International Economic Law. Thank you.
Thank you. Good afternoon.
I also have with me in the studio Dr. Alero Roberts. She is the Vice President, Association of Public Health Physicians of Nigeria, Lagos State Chapter. Thank you for joining us on the panel.
Thank you very much for having me.
Online, we have Dr. Ikifa Charles, President, Association of Resident Doctors, Irua Specialist Hospital, Edo State.
No, I can't hear that from the studio.
Then I'm sure we'll get to him soon. Then we have Chukwudi Diko. He is a financial expert and politician, former gubernatorial candidate joining us from Connecticut, USA. Thank you, Chukwudi. We also have online Dr. K. Adeshola, the National First Vice President, Association of General and Private Medical Practitioners of Nigeria. Okay, before we start our discussion today, we'll take a background story that helps us understand a bit what brain drain is. The brain drain phenomenon has a long history. In 1963, it was coined by the Royal Society to describe the exodus of British scientists to the United States of America, seriously jeopardizing the British economy. But this term eventually became common use to describe the emigration of scholars and professionals from the third world countries. As a result of the migrations, investments made by these nations on the formations of their nationals were used by developed countries. The results were unjust technological aid to richer countries by poorer ones. Brain drain is still glaring today, with many skilled professionals from Africa migrating to the Western world and other vibrant developing nations for greener pastures. This move is taking a toll on the development of the continent. Some scholars have pointed out that the trend could result in serious risk of brain waste, as observed today, because not all the migrants are able to find jobs at the level of their skills. Now, we've heard how the coinage brain drain started. And to think back that as far back as in the 1960s, there was a case like that where many skilled workers migrated from the UK to the United States, and importantly, it affected their economy. And today, it's a trend in Africa and also in Nigeria. Why should we be worried now in Nigeria? Let's start with you. Pastor?
Um, it's interesting that we started with the 60s. I think it's even further than the 60s because there was a time and a season in the life of, or let me just say, what our country is experiencing right now is an effect of globalization. Aside the fact that we have economic distress, we have economic downturn, people are looking for a way out to better their life. There are just two major factors responsible for it. It's the factor of the push and the pull effect. Pull in the sense that people want a better life. And if they cannot get it around here, they know the amount of value of dollar to naira. They will go for that, especially when they have the skill set where they will be paid according to the value they think they deserve. They will move to that. So that syndrome will pull them out of the environment. The push dimension is the fact that when you look at it, you feel you are stuck with the economic distress. You feel you are stuck, you can't afford basic amenities, and you have the skill set that is equivalent to your colleagues abroad. And what globalization does for you is that it opens you up to possibilities in other parts of the world. So Nigerians currently are facing that. At a point in time in the life of Germany as a nation, a lot of their scientists were pulled into the United States. At the likes of Albert, they have German origin. So it's even further than. So what normally happens is whenever you see cases of economic depression, insecurity, and that sense of loss, of not being able to actualize your dreams, not being able to fulfill all your aspirations, you go to school for many years, after ASU strike, you come back, you're stranded, people will look for a better alternative for their lives. And that's exactly what is going on.
Okay.
I'm going to have to agree with him on that, and in the sense that you've got to realize that, first of all, we're talking brain drain, and coincidentally you've brought on 3 physicians, so I presume you're talking about the medical brain drain, but it's not just doctors.
Why I brought the doctors, because if you do the research in history and even now,
Yes.
it is the health sector that is
It's the
usually...
Yeah.
It's the scientists.
Scientists, particularly the health
Yes.
sector,
Yes.
that is usually affected
Well, the health sector is
when we
going to
talk
be
about the
affected.
brain drain.
The health sector is going to be affected because at the end of the day, health is everybody's business.
Yes.
No matter what you're doing, who you are, what age, whatever, health is wealth. And if you're not healthy, that's the place where it's going to be felt the most. But it's being felt in the education sector because right now we don't even have tutors.
Yeah.
For nurses, for doctors, for physiotherapists, we're losing the tutors, we're losing the scientists. We've lost a lot of the IT people. People don't even realize that a lot of our IT that is being, we can't host
Yeah.
sites
Yes.
locally. Our sites are being hosted abroad
Yeah.
by Nigerians. Funnily enough, we all joke about it. All the politicians who go abroad for medical care are being looked after by Nigerians, Nigerian nurses, Nigerian doctors. So that's the reason why it's so keenly felt in the health sector, because at the end of the day, no matter who you are, whether rural, whether urban, rich, poor, in between, if your health is affected, you are affected.
Okay, obviously, when it's a source of worry because
It
I mentioned how it affected the economy of Britain way back, and in our country we don't think it's a problem, but it is. On the average, according to a report recently done by some researchers in Africa, it shows that on average it cost African countries between $21,000 and $59,000 to train medical doctors.
Yeah, but it's not all government money.
Yeah, no. Averagely, if you have to, even if it comes from your
But it's not
pocket.
all government money.
Yes, but if it comes from it's still from our economy. Even if it's not government money, it's still from our purse and from our nation.
And so when they go abroad and they pay back,
until we start taking that into consideration and not start thinking about I paid the school fees so I leave the nation, it is still going to hit back on us. That question wasn't for you, doctor. It was for Chukudi. Okay, so with all these funds that were popping both from private and government into training our skilled workers, doctors, nurses, IT personnel, and they end up in the developed nation. You're somebody who you've lived in Nigeria before and you're now in the US. Can you tell us about what happens eventually when some of these skilled laborers end up in the US, for instance?
Thank you very much, Jennifer. Good morning, good afternoon, wherever you are. Sorry for the technical difficulties. I didn't get to hear most of the earlier segment, but to go straight to the point, Walter Rodney wrote a classic many years ago. He called it How Europe Underdeveloped Africa, which made reference to the transfer of skills and labor from Africa, which then it was forced, of course. But today, we can say Africa is underdeveloping Africa, or closer home, Nigeria is underdeveloping Nigeria because of the transfer of skills, not just the doctors, but different professions. Now, it's a big problem. It's a big problem, one that is getting worse. And if something is not done, it has serious consequences for the Nigerian economy. Um, there are so many causes for this labor transfer or brain drain, as you will call it. Part of it is bad governance, part of it lack of infrastructure, poor working conditions for the doctors and other professionals, poor pay, um, insecurity is a big part of it, and of course, people seeking to have a better life for them and their families, especially in the area of education. Now, those are internal factors to Nigeria. Externally, there are also other factors that are contributing to the increased brain drain. One, which I'd like to emphasize, is the globalization of labor and services, which now makes labor and services marketable from anywhere. So it's the question of the highest bidder. Coming home to America, there's something we call the aging of the baby boomers. The baby boomers are the older generation from the Second World War, and a lot of them now are getting in their 70s and older, and they require a lot of healthcare services. And same thing goes for Canada, and I believe same thing goes for UK. So you have an aging population that is demanding, consumption of health services, and at the same time, you have this situation in America because of the level of development where the young people today are not so crazy about those classic professions like medicine, the law, and all those. They are more into the what I call the leisure uh, preoccupation. They want to produce their own content. They want to do things that give them freedom to earn a good living and enjoy quality time at the same time. So what you find out is that they are now relying on a lot of foreigners, Nigerians, Indians, Pakistanis, to come in and fill that gap in the medical services. So the demand is very high, and they are able to
If you're hearing me, I asked the
pay
question.
handsomely. They are able to pay handsomely for the services of our doctors. I mean, I did a little research that tells me that an average Nigerian doctor makes about $400 a month. $400 a month. Now compare that to an average of about 15,000 US dollars a month here. What do you tell that doctor? Um, it's a tough situation, but as we go along, we can talk about the effects.
I asked a question that he didn't answer.
Okay.
Because it's important for us to also highlight that. We talk about brain drain, about people transferring skills to the Western world. And I know there's good pay there because I know you told me the other one that many mothers will not be happy that we're talking about their kids not going abroad, okay, because they will make good money and all that. But there's also the problem of brain waste,
Okay.
which is what I wanted him to answer.
So let's unpack that a little bit.
Yes, let's unpack
yeah.
the brain drain.
Yes.
Because
Brain drain.
sometimes we have a situation where some of our best hands leave Nigeria and end
They're
up
not
in the
practicing
Western
what they're
world
trained for.
doing odd jobs that are not even up to their skills.
So that's what you're defining as brain waste.
Yes.
Fine. He may end up washing plates in the US, for instance, but if he's earning enough money washing plates that he can maintain his mother in a way that he could not maintain his mother here as a doctor, you then have to ask what is his first priority. And this comes back to the personal, to the personal reasons and decisions that people can take, and they are right to take those decisions. And the important thing that people have to realize is that while we are talking of brain drain or brain waste, at the end of the day, I matter most to me. And I have a right to determine what defines my self-actualization, what determines my self-worth, what things I am ready to do. So, I mean, everybody knows my story. I trained as a doctor, and then for 14 years, I stayed at home bringing up children. That was important to me. And why you can say, oh, but what a waste of your training and so on and so forth. No, no, no. I was doing what was important to me, what defined me, what gave me satisfaction and self-worth. How would I deny anybody else that opportunity?
True.
Even if, as you say, they go abroad to go and wash plates.
Okay.
I mean, I think it will be a shame for us that they would earn more washing plates.
Okay, that takes me to the question I want to ask now. Rather than a situation where we'll have our best brains not add value to our nation because of certain factors from our end that has become like a hindrance to their own progress, personal progress that would have impacted on the nation, what can we do to ensure that these best brains don't leave Nigeria and end up elsewhere, not even practicing what they've studied, meanwhile they are good and can give us those services in Nigeria?
Very honest. I won't sacrifice my survival at any point in time when my life is at risk in a security situation or in a survival situation where I have to feed, I have to take care of my health. The body language of those who govern us in this country has suggested to everyone, you need to fight for your own life, because when our political leaders are sick, they run abroad, which is an indication of the lack of confidence in the system. So when that is a prevalent orientation, to now tell someone with so much skills to stay back in Nigeria and help the system, is going to be very difficult, because there's a lack of trust.
No,
It's a lack of trust. One has to be very realistic.
Dr. K, can you hear me?
Yes, I can hear you.
Okay, Dr. K, I was asking, I said, how can we ensure that our best brains stay in Nigeria rather than end up in the Western world where they end up doing odd jobs that are not even on par with their level of skill?
All right. You are still referring us back to your terminology of brain waste. Actually, some of the doctors go to America and because you have to do what we call licensing exams. You don't just jump from one country to the other. You want to be sure that you actually qualified.
Yes.
And so you must take your time to blend and study their system and pass their licensing exams. So a lot of people end up not even doing that exam. They look for some other cheaper things just because, like Dr. Alero said, just because they just want to live a better life, regardless of having to keep practicing whatever they have learned here. Now coming back home, how do we make our professionals and skilled labor to stay back home? A lot of factors actually make people to leave Nigeria to this so-called greener pasture. Actually, if you're asking me, my home Nigeria is always the best for me at any point in time. So it's always the situations here that are not really conducive or that are limiting me, are not allowing me to express myself the way I want to, or where I don't get satisfaction in terms of economic needs, just to meet my needs and all the rest of them, that actually drive me. So if you are talking of what will make us to stay back, not going away from this part of the world, then all of us have to work on that. The government, we have to create a conducive environment. The workers, I don't want to limit this to doctors alone, even though we are severely affected by this, and it's obvious to everybody. But then the conducive environment needed, the economic remuneration for whatever work is done. Security is very paramount. The issue of corruption is a problem. There are so many factors we need to tackle. Infrastructure is not there. Some doctors left before now because they were not getting satisfaction, not necessarily because of the money. And then when you now talk of a situation whereby you make doctors to work for 3 months, 6 months, and you tell them there's no pay. When we look around us, we see what is happening. Look at the so-called hazard allowance they pay. How on earth do you justify 5,000 naira? And yet we know people who don't face so much hazard. Now we are told they are being paid 1.2 million per month. And then those of us that are risking. In the last few years, I've had to operate on at least got myself pricked with needle while operating on HIV patients. So these are things we face this every day. Look how many doctors have dropped dead since COVID started. I'm talking of in Nigeria here. So a lot of things are making us to look at better. And then when you look at situations around you, the corruption is there. You can hardly get anything on merit in this country. And those of us that are interested even in research work and others, even to get the grant is a problem. The other time, money was said to have been voted in 100 billion naira for for health sector in this country. They call it what's it called? The intervention fund, which most of us were never able to access to today. In other climes, grants and other things are being given. When you look around here, you find that the situation of things is always more or less limiting you or against you. You're not going to live your life twice. You have gone through all sort of training. You have been brought to the level which you are, and yet you cannot express yourself. You are not allowed to do what you feel like doing. Now, in most of our government hospitals today, what we are practicing is not medicine. You see a doctor seeing 60, 70, 80 patients a day. At the end of the day, you don't have the time, the power, and the strength to see them properly. So we're actually not allowed to give our very best. In most places where you are able to work, by the time you have seen 10 in the day, you have really worked. But here you are seated there, you are working, seeing 40 patients in a day, 50 patients, so you can't see them well. At the end of the day, we're not giving the good services we have been trained to give. We're not able to give it. And at the end of it all, as if that medical doctor does not have a family, does not have a parents, does not have other dependents, you hold on to the salary and say, keep working. These are things that we need to reverse. Until we reverse all these things cannot, people will keep going, keep looking for greener pasture. And some of them, like Dr. Lero said, would rather go and wash plates and survive and live a quality life than being here in Nigeria and being tied and being wasted. So brain drain, even though you can have it, even brain being wasted there are some aspects of that can also be said to even be available right here in Nigeria.
Okay, thank you, Dr. K. It's obvious from what he said that although the health sector is greatly affected by this transfer of skilled labor and brain drain, the important thing is that people want to earn a living, lead good lives, pay their bills, and work in good environment. So we'll take a break now. When we return, we'll continue with this discourse. Welcome to another interesting episode of The Panel.
We must always point out what June 12th really meant. Recognize the aspiration of the youths, of the masses.
Workers are celebrated the world over.
Health programs to build capacity of maybe nurses.
All of us were once children, and if you look back on our upbringing,
government to partner with different organizations and individuals.
Because engineers, this takes care of all professionals in this area.
That's how much we can take on the program today. Many thanks for watching, and don't forget that the program continues.
Experience unlimited super-fast internet access from Entel 4G. Entel. Live more.
Back to Lagos now, where here we know how to expect a report.
in Lagos,
State houses of assembly have charged the federal government
Welcome back. Now we're talking about brain drain and implication on the nation's development. And I want to note something that 9 countries, according to research that was done recently, 9 countries, Ethiopia, Kenya, Malawi, South Africa, Tanzania, Uganda, Zambia, Zimbabwe, and Nigeria, have lost billions since 2010 from training of doctors who then migrate. Okay, so no matter how we discuss them, the implication of brain drain, it affects teachers, IT sector, but the sector that is most hit is the health sector because in the long run, it affects healthcare and delivery. So we've talked about why people want to live abroad because they want better lives. Okay, so now let's now go to the issue. And we also mentioned what we can do to keep them in the country. Well, we didn't exhaust that. But what I want to ask now is, well, sometimes the greener pastures are not so green, okay? And I know you don't want to agree with me when I say nation first. How can we create a balance so that if we know that the situation in the country is not so
Interesting.
is not so I don't know what word to use. It's not so good. It's good but not so good. Isn't there a way doctors can also be a bit patient with the system?
Well, I think he said it best.
For the sake of the common good?
No, he said it best when he said that there's no way you can add value to a system that doesn't value you. Nobody stays where they are not wanted.
What about the people themselves that value you?
Nobody stays where they are not wanted.
No, but what about the people themselves that value you?
The people
I had
don't
the
value
privilege
you.
of...
The people don't value you.
No, the people you treat value you.
I work in the hospital. I know what I see. Do you know how many nurses have been killed in the hospital where I work? Killed by irate patients? Do you know how many doctors are attacked?
Unreported?
Unreported, because there's no reporting mechanism. Do you know how many? My niece was attacked by an irate patient's relative through no fault of hers. The fault was the person moving the oxygen tanks. I mean, these are the things. So when you don't feel valued by the system, we're not talking about, forget Ngige. I'm not even talking about that
Dr.
level.
You know, in my own case, I came back to the country after a few years. I lived there, worked there in England. I just felt the need to come home to add value.
Nation, yes.
Now, my friends are asking me now that what revelation did you get about this country that brought you back? I'm here. I'm adding value at my own pace.
You're a patriotic Nigerian, please.
But my decision was just not only about Nigeria alone. My decision was just not only about Nigeria alone. I have a vision for my life. So an individual has a vision of where he wants to go. So the question is my country helping me go in that direction? So we need to be able to answer those questions for those people before we tell them that be patriotic. Because the question is, an hungry man doesn't have any ability to reason things through.
So let me raise another issue. Because to be honest with you, listening to this Afghan issue and watching the debacle of the what did occur to me was the number of people who, even though they had fought to get out of Afghanistan, really wanted to stay. That resonated with me. And listening to young professional women whose hearts are clearly in the country, but recognizing that for their own safety and whatnot, they needed to leave. The truth of the matter is nobody really wants to leave. You said it. You said you're of more value to yourself in your own country than you are as a second-hand citizen in...
Okay, Dr. Ekifai. We have Dr. Ekifai online. Dr. Ekifai, I want to find out from you what can be done to ensure that our best hands, skilled laborers, professionals, stay in Nigeria and add value to the nation.
Jennifer, thank you for having me here. This is something that can be done if actually we have a system that is ready to make sacrifices and changes that will enhance not just the healthcare delivery, the economic situation, the security system, and then the welfare of the skilled personnel who are giving out their services to the nation. Very simple things that can be done. Just enhance employment opportunities. Because when we talk about brain drain, I don't want to limit it to doctors only. There's other There are other professionals who still live, sometimes haven't been trained, very much interested in delivering services to their nation, but yet they do not have the opportunity of a good job. Now, some of us have jobs, but there are the situations where you work, the environment where you work, circumstances around your workplace does not give you any breathing space. I can tell you, recently in my center here, a professor came from OAUTH for an examination for medical students, and then on his way out of the community, he was shot dead. I can tell you the kind of people that I've had in our system here, because some persons that you want to invite for exam this place, they will not want to come back. If a professor who had trained, a professor in pediatric, I think pediatric neurosurgery also, I can't remember, was shot dead with the investment in that kind of situation, in that kind of, that he has invested in his life, he has gone to a point where he should begin to deliver to society and also enjoy the sacrifices he has made to get to where he is, and suddenly shot dead because of the security issue. So if there is enhancement of security, the work environment is improved, the economic situation is generally improved, and then you give people opportunities to deliver the skills that they have by giving them employment. I believe somehow they deserve to stay behind and then begin to work in other areas to ensure that there is a good productivity in the nation will be there. If these things are not there, there's no way. And why it is very serious is now is that you can see from your own observation that we have representatives at the helm of our affairs in political leadership whose interest is not in that direction at all. If you, for instance, are putting this on ground and we are thinking, oh, in the next 10 years, possibly what we are doing now will begin to yield the products or begin to produce, we'll say, oh, let's be patient and wait for the 10 years, let's sacrifice this period. I'm sure within that period of 10 years, we'll see the results coming out. But what are we saying? We are saying that even what our fathers have laid down, the sacrifices they have made, have been destroyed. And then the future that we want to envisage has been destroyed. So if you sit down and envisage where you are coming from, think about the future ahead. It will be a foolish man that want to continue to stay, because nothing is in view at all. I think those are the reasons why when you sit down and reason and you think about what you have done, what you have in mind to achieve and accomplish in life, you just want to move out and then go ahead, because nothing is on ground for a better tomorrow.
Okay, but sometimes we put the blame on the government and the system, and I have to say that because most times the majority of things that need to be pushed to make the system really flow comes from them. But are there things, I'm just asking, are there things that can be done by the private sector or other initiatives that we can do to create an ambience that can make people stay?
There is a lot.
Okay.
And I think we've seen a lot of the evidence of it starting. Particularly the one, if anything good could have come out of Ebola, for instance, it would have been the fact that, the initial forays into actual practical public-private partnership were seen. The way the Lagos state private sector stepped up to the plate robustly and supported the state government's mechanisms to really deal with the Ebola.
I think they also did the same thing in the COVID.
Which, of course, was now replicated, which was replicated actually even during Lassa, the measles outbreak, the monkeypox. People don't even realize that we were dealing with those epidemics in between until, how did we get certified polio-free? That was a classic private-public partnership that worked, where the private sector literally took charge, and here we're certified polio-free. So there's a lot that private sector can and is doing in redressing this situation. One of the things that I can see happening, and I mean, maybe it's too early to boast, but I don't think it's ever too early to boast about a good thing, is that we have seen an upsurge in the number of private health facilities that are being set up to international standard.
True.
In Lagos State, in Abuja, I know there are a couple, and I'm sure there are quite a few around the country. And I think they may be spotted for now, but as this situation continues to deteriorate publicly, we'll see this growing privately, and eventually the financial access will even out because more and more people will jump on the bandwagon of pooled resources and
Talking
and
about
fit in there.
Can we also, because we seem to be focused on the health sector alone, I agree it's important, the doctors are important. A lot is happening within the educational sector.
Absolutely.
For example, we were talking about Pan-Atlantic University earlier. That's a classic example of standard educational system being built. The likes of Covenant University, the likes of Bowen and all of that. Because when you look at the quality of graduates that we are producing today,
from the public universities.
I work with a lot of schools in this instance. I am aware that they're understaffed. The alumni body of some schools had to come to pay and enroll for teachers to engage students in schools. I'm not even talking about just the learning aids, the infrastructure now. I'm just talking about the personnel. The brain drain is in that area. And education is very important. It's one of the most powerful resource to train people.
And there's also this situation where some of the universities abroad come to
they advertise here every weekend.
Not just advertise here, they come and they have their screening processes.
Yes.
And they take some of the best brains from secondary schools and higher institutions.
Give them scholarships.
And take them abroad.
Yes.
So it's not all doom and gloom alone with the activities of these private initiatives going on. I think we're gradually solving the problem. But it's just at a certain percentage. So because I don't like it when people abdicate responsibility and we push everything on the government. And that's the problem with our society.
Yeah.
Yes, government is meant to create the environment. Yes, government is meant to set the tone, initiate the policies. But there's this dimension of individuals starting to chart the course. Then government officials can do a catch-up.
Yeah, I don't want to focus on the health sector, but I need to ask Dr. K this question. Because we know that the private sector are coming up to bridge the gap and help. But the same problems that those in the public sector complain that the government is doing to them is also what those in the private sector complain about poor pay.
Yeah.
Because when we blame the government about not paying those in the public hospitals well and good environment, the same things people in the public hospitals complain about is also the same thing those in the private sectors complain about. They're also not well paid, they are old, and then they don't have good working environments. So I want you to comment on that.
Yeah, like you said, I think when you are under a particular environment, there are a lot of things that you cannot really take away from one sector and think that it will be totally diverse from the other. What I'm trying to say is that as much as possible, the private sector, the private facilities you are seeing, we are doing our very best. We don't have any form of support. Like the last time I was talking, I mentioned the issue of intervention loan that I never got to most of it. Now, when you go to every private facility you go to, the doctor or the medical director or those in charge of that hospital happen to be the provider of virtually everything they need to do, energy supply, water supply, just name it. And as of today, the private practitioners in this country, we still run up to close to 70% of healthcare of this system. That tells you we are employing up to about 70% of the healthcare workers we have in the country. And that is, we are doing our very best. We need the backing, we need the support, we need everything possible to be able to boost our practices, to get the best of equipment, to get the best of financial support. A lot of, for over some years now, at the NMA level, at the AGPMPN level, we have been asking for a health bank. Since nobody's giving us financial support, we don't get anything. And one of those things that will have given us edge in the country is the issue of this universal health care through the health insurance scheme. But unfortunately, a group of intellectuals came together and put a complete document together. Along the line, some people tampered with the document, where situations such as where they say health insurance should be compulsory, people make it to be like it may be. And as a result of that, some people capitalize on it. As of today, the majority of people that are still on the NHIS still are just the government workers that were more or less railroaded or forced into joining the scheme. Whereas one of the best instruments we have to achieve better health care in this country is through the health insurance. And now majority of Nigerians are even so badly impoverished that they can no longer afford the basic, the littlest of all needs when you get to the hospital. So while the hospitals are shrinking, except for the few ones that are coming with, mega box from outside the country, we are really finding it very, 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 tough to survive.
Okay.
So if workers come,
okay,
you are talking of workers not being adequately paid. What we are facing is worse than payment. We are not having enough workers anymore. In my days, I graduated 1992. That's about 29 years ago. Because you could walk down from clinic to clinic, you get locum, you get jobs and things like that. These days, we, the employers of labor in the private practice in this country, we more or less take good care of our workers more than before. Because the moment you lose one doctor or one nurse, it takes you a lot of time to be able to get another one.
Okay, thank you, Dr. K. I get your point. Thank you, Dr. K. Now, there's something we do on this program. We always allow people on the streets to have their say on whatever topic we're discussing here. So let's take that vox pop.
Nigerians are smart people, and if we are losing the smart people to other countries, then how does the health sector improve? So it's a loss for Nigeria.
It's supposed to have maybe a positive effect in the fact that they'll get a lot more training and experience, but at the same time, if life is better over there, most of them will not come back, and then we are left with no doctors to take care of us here. So it's a really sad situation. Improve on their remuneration and their allowances so that they can take care of us here too. Not everybody can leave the country. So.
They are living for what they believe is a better life. So you'd have invested so much in yourself, and then I guess they are not paid to what they would expect. I mean, doctors take an oath to care for people. Imagine a doctor made a decision not to take care of somebody because of bills, because of payment, and sometimes people can't afford payment. So what happens? Nobody gets treated. They're just pained. So the big question is, what do you need to change in the health sector for doctors to stay?
Most people can't afford to cater for their own health. So these people that can help, them migrating Nigeria, it doesn't speak well, because how do the people that can't actually afford to go over there to cater for themselves, how can they actually take care of themselves? So it's just increase the level of death.
Okay, welcome back. Let me go to Chikudi, because there was something you said earlier on. Because most of the people, the respondents there, you can hear that they were mentioning the doctors, the health sector. But of course, there are other sectors where we have massive exodus of Nigerians, the people from the IT sectors. I know many people who are relocating now, who are doing this migration programs that some nations are doing now, who are relocating with the whole of their businesses, whether in the oil sector, those that are relocating. Okay, so, but there was something you said, Chikudu, that's why I'm coming back to you, about how people can create business for themselves without actually relying so much on the government. And so we don't have a situation where we have especially young people thinking of leaving a nation where they can do something for themselves and earn a living here.
Thank you very much. Before I answer that, Jennifer, I want to go back to the question you posed to me directly about brain waste. Let me tell you categorically, there are no Nigerian professionals, doctors or otherwise, that are coming to America and wasting their brains, all right? Nigerians are too smart. Nigerians are some of the smartest people in the whole world. And what you find is when Nigerians migrate here, it takes them a very short time before they assimilate both occupationally and otherwise and get into what they want to do. So even in the meantime, the doctors that come here from Nigeria, like Dr. Adeshola said, they might not get into medicine practice right away, but they start with allied services, phlebotomy or providing services to aid other doctors while they're preparing for their board certification and exams. So Nigerians are very smart and very resourceful, And in this country, there's hardly an industry you go to that you don't see Nigerians in large numbers at the very pinnacle of that profession. And that's something that we're very proud of, very proud of. Now, some of you might remember Enebeli Enebuwa back in the 80s, Andrew, Mr. Andrew, Nigerians don't check out. That was a big campaign by the government back then. So this problem did not start today. Everything starts and ends with leadership. If the leadership doesn't even acknowledge that the problem exists, what are we talking about? Let me give you some statistics. The ratio right now is 1 to 5,000 doctors to patient in Nigeria. Nigerian government currently spends about $50,000 to train a medical doctor in Nigeria. In the last 10 years, that's $2 billion lost to the Nigerian economy. We spend about 400 billion naira annually on medical tourism. India, UK, America. Not to talk of the loss of human capital assets and loss of tax income to the government. If this is not enough, if these are not enough to worry the government into performing, I don't know what else. You talk about leadership again. The president of Nigeria goes to UK every, 3 months for medical checkups. A country like Nigeria, the giant of Africa, does not have a hospital that can take care of its president and its dignitaries. It's a shame.
That's the problem. I asked you, because we're running out of time, I asked you a question. I was talking about what we can do. We're looking at the way forward now because we have looked at all the problems.
For the sake of time, I'll give you something real quick. I read about countries like Saudi Arabia and UK coming to Nigeria to host open recruiting campaigns in Nigeria. That has to stop. We cannot allow other countries to come into Nigeria and just wholesale take our talent away. Also, we need to start banning some of the medical tourism, starting from the president and the government officials. Make it just ban it. You cannot go out. If you cannot provide those services for us here, you cannot go out. And now, the last one I want to say is, we can negotiate with some of these countries where our doctors and professionals are heading. Say, listen, fine, we cannot stop our doctors from coming here, but this is what it costs us in subsidy to train a doctor. If the doctors come here, you have to reimburse. You have to reimburse Nigeria for the cost of training that doctor. It could be, whatever amount that it took Nigeria to train those doctors. And of course, we need to do some massive investments in the educational and health sectors. Nigeria is 200 million people with a lot of young people who make up.
Okay, thank you, Chukwudi. We get your point. Thank you so much. I like what he said about other nations reimbursing us when our professionals go there.
It's unrealistic. It's unrealistic.
We can negotiate. Okay, please
unrealistic.
Let me take briefly way forward from you.
The first point is this. Our problems and our solutions stems from the quality of leadership that we have. If we have a visionary leadership that will create an enabling environment for Nigerians to thrive, for their gifts, their talent, their profession, their career to thrive, nobody would think about going abroad. So the solution is this.
I talked about what we can do to keep...
That's what I'm saying. Okay. We need to create an enabling environment. First of all, I decided to take my destiny in my own hands. Be responsible for myself. Venture into business, start an organization, run it efficiently, run it world-class, world standard, treat people well. Then create an accountability structure in our governance system. He said it that once we get government officials to stay here and stop going abroad for there's somebody abroad now. So
okay, let me take Dr. Alero's point. I told you briefly, so you were using too much of your time analyzing something else.
Number one, I like what he said. The people in political office cannot go abroad for medical care, and if they do, they need to be questioned and held accountable. Two, one of the steps that everybody is mentioning is the private sector taking the lead, and I am glad to say that I have seen areas where private sector is taking the lead, and I know it can only grow because nature abhors a vacuum.
Yes.
Okay.
And that is going to happen.
Okay, that's your brief contribution. Dr. K, your brief contribution.
Yeah, thank you very much.
Brief.
I will, hello. I
yes.
would love to also align with the fact that things must start with our leaders. And our leaders must be careful with the kind of comments that are coming from them as leaders. They should make comments that will encourage people to stay, not people to run away from this country. Doctors are not exported by Nigeria. People are going because home here is no longer conducive. Doctors are not going abroad because they want to repatriate dollars to Nigeria. No,
okay, that's your brief comment. I take it that's your brief comment, Doctor. Okay, Dr. Ikifa, briefly, your last word.
Thank you very much. I would say for the health sector, there should be increased commitment in terms of allocation, budgetary allocation, to enhance all the requirements for a better and conducive environment for all the workers in the health sector to do well. I think that's one of the things the government should do, and that will help to put the problems down. Thank you.
Thank you very much. Oh, thank you for being so brief. Thank you very much. Now, the bottom line is, I know we have challenges in this nation, but Nigeria is our own, and it's the only nation we have. So no matter how bad it is, I think there should be a place for patriotism. We should also think what we can do for the nation, not what the nation can do for us. I create a balance, and rather than go give all the skills to other nations, we should find a way of working out things here, patient enough, and use, that's what I was talking about, inventions that we can do, use maybe online, and still stay in Nigeria and make money rather than leave the nation, okay?
I shall be holding my bread.
I know she will not agree with me.
It's not realistic.
And I know some parents watch.
It's not realistic.
And I know some parents,
and I
know some parents watching and looking at me like,
it's not realistic.
You don't spend that kind of money training your child.
When you start something, one government policy can strike you out. Look at the guys in the fintech industry. Look at the revolution taking place. But a CBN policy came in a few weeks ago and dismantled everything. And people are losing their lives, losing jobs. We are talking about doctors alone. Do you know how many people the fintech guys have lost?
Until next week. Thank you. We'll continue the discussion outside here. Like I said, we have to think nation first, okay? It's not every time we think about what Nigeria is not doing for us. We should also think of what we can do for Nigeria. So until next week, when another episode of the panel comes your way, I am Jennifer Igwe. Thank you for watching.